Well, hey there, Hidden Nation. It's so good to see you. Welcome right into the studio. It's Josh Cary here. It's your hidden entrepreneur. You're tuned in to 710 WOR, the voice of New York, sitting here on the iHeartRadio app. Just download that free iHeartRadio app, and you can listen to this show, the entire back catalog, or any other show you are currently consuming. Come on over. The water feels great. Hidden Nation, we have such a great show for you today. And not only a great show, a very important show. Because what is more important than our health? Really, dare I say nothing, right? Literally nothing can be more important than our health. And today we have a very, very solid guest. It's Dr. Mark Levandovsky, who is a triple boarded doctor in oncology, hematology, and internal medicine, to talk to us about prevention and a path forward. Sit tight and wait until you hear everything we're going to dig into. Doctor, so good to have you on the program. Welcome.
Thank you so much. I appreciate you having me here.
It really seems like from everything you do, it's almost counterintuitive from what somebody like me as a patient sees, because I always assumed that when I'm not feeling well or something is bothering me, I go to a doctor. But it seems like part, if not most of your approach is in the preventative stage. What gives there?
Yeah, absolutely. You're so right on, Josh. We're so reactive in traditional medicine. We're really behind the eight ball. If something happens, you have chest pain, then go for an evaluation. Make sure you don't have an, myocardial infarction, a heart attack. If you're having neurological symptoms, let's see if you have a stroke. If you have pain and you're losing weight and you're coughing, maybe you have a cancer. Let's see if that happens. But then the thing is, those conditions take typically decades to develop, and you can really go back in time and see, well, this is where it's starting, and how do I either early detect or how do I even prevent? So my practice is really preventative medicine and screening. So depending on how young you are, you can really focus on prevention. If you've had some hard living, 60, 70 plus years of exposures, then early detection is really the name of the game. So, and why? Because we know that saves lives. And why doesn't it work the other way around? So meaning if, say, I have, if I'm developing a cancer and I wait until symptoms hit, that becomes traditional oncology. And at that point, we usually have more than 1 billion cancer cells in our body. We have an overwhelming chance of metastasis. So if we wait for symptoms, if we are reactive, if we follow the traditional path, then most likely the odds are such that we have metastasis and the game is really lost. So, and that's true. Like if you look at the National Cancer Institute and various academies of medicine data, if you follow your traditional primary care recommendations to the T, you detect 14% of cancers. 14%. 78% of what kills you is going to go completely unnoticed until it's too late. And that's why it's just such a pandemic. It's really the silent killer, right? The big C. And the same is true for cardiovascular disease. The vast majority of risk, folks who are really going to succumb to those strokes and heart attacks, they have minimal to no symptoms prior to the big event. So if you wait until the big event and, cancer symptoms, cardiovascular symptoms, autoimmune symptoms, you are decades behind. And that's why so much of what I do and the huge focus is really on risk assessment, geared towards each individual. So what is your individual risk, and how do we reverse as much as we can, depending on how much you've done, what you are like, and if we can't, then how do we early detect?
It seems like that kind of approach would upset big pharma. What I've heard from my minimal point of view, again, as a layperson, we always hear whisper, whisper, the pharma company doesn't want to cure cancer because how are they going to make money? Where's the truth in that kind of thinking?
I think the big pharma is going to make money regardless because just psychologically, we are very much away from, meaning that we are really waiting for that big event to happen. So what I mean by that is you need to be super motivated and very much forward and health conscious thinking to say, you know what, I'm fine, okay, right now. I don't have anything big, and let me look at health and wellness and what can I do to get better. Most of us really are reactive by nature, psycho-emotionally. We want to run away from pain. We want to avoid suffering. We want to do what's comfortable, right? And uh, making changes that are more health conscious could be very uncomfortable. It's like politics, food, and religion. You don't really want to go there unless you have to go there. So just psycho-emotionally, and the way our culture is structured, and much of it is education, and that's what I do. We are going to wait until things are going to be intolerable or concerning, and then we're going to run and we're going to be behind. So as a result, the big pharma is always going to have a role. And I think, it's hard for me to blame the pharma per se. They have if it wasn't for the big pharma, we wouldn't have the outcomes in cancer care and cardiovascular care that we have. I would love to see the health system and the big pharma really encouraging health, wellness, and education as to what constitutes risk, how do we get here, so that some of these resources are being really geared towards prevention, just because they have such deep pockets, not because, I don't think it's really going to affect their bottom line a whole lot, just because of how we are as humans. But it would be a very, very impactful thing. Like, smoking cessation, right? The reason why smoking cessation and drug programs for prevention don't work is that we don't address the underlying mechanisms that drive it, right? It's not like Josh, don't smoke. Josh, don't do cocaine. Like, Barbara Bush would say, don't do this, right? Okay, so if I don't do it, what do I do? So you need to tell someone that, okay, you're doing this for this reason. Let's fill that niche with something that's actually good for you. Let's figure out why you're doing what you're doing, what makes you tick, and what can you replace this behavior with that's healthy and proactive and actually going to make you a better human being. And as a consequence, by the way, you're going to live longer and better. And we don't do that as a society. We run after what's fast and easy. And it's it's been very tough for me as a head of oncology for breast and colorectal cancer to have patients say, just give me higher doses of chemo. I'm not willing to make any lifestyle changes, because chemo dose is really proportionate to their body habitus, to their weight and body surface area. So the more they're willing to change things, nutritionally, lifestyle wise, the less the poison, the fewer the side effects. And that's not always the case, unfortunately. Folks are willing to go there. So big pharma, that's a long answer, is very much going to be there. I would love to see more education and really dispelling the myth of what constitutes risk, and empowering people by really sharing the evidence-based information, not by throwing these glamorous alternative methods. Just take mistletoe and everything will be fine, or have vitamin C and it'll be the panacea. That's never the case.
Hidden Nation, you're tuned into my discussion with Dr. Mark Levandovsky, a triple boarded doctor in oncology, hematology and internal medicine. He has what he calls a CRS, a cancer risk score, where you can take a self-assessment on his website, pmccdenver.com. You can take the assessment right now for yourself. Doctor, this is all about what I'm seeing where I'm going to talk about me personally. I'm 49. I'm going to be 50. My goodness, this year. I have a beautiful 8-year-old daughter, an incredible 8-year-old son. So that some years ago was enough to wake me up and say, wow, I want to live as long as possible. And my health and well being is probably the best avenue to that. So, somebody like me, what should I be doing? Because I appreciate the fact that I don't have to wait until something's bothering me. Yeah, I go for my annuals, but you're saying there's a step in between all that, right?
For sure, yes. And just to, as a way, by way of background, like after 40, it's all
Please.
downhill, but it's also very much a wake-up call, especially for men, interestingly. Women usually are a little bit more proactive and they're awesome. So they usually start thinking about health and wellness in their 30s. But for men, it's really after 40.
Wow.
We start losing about 1% of muscle mass a year, and it starts accelerating. So
Wow.
it's really so many men complain, hey, I'm in my 40s now. It's just takes way more to be healthy and even to maintain your level. I'm like, yeah, of course, because you're just aging. Welcome to fallibility. You're no longer invincible. So it's I suppose it's a good thing because it's really a wake up call and say, hey, I can't keep doing the same stupid things and get away from with it, right? I just can't. So the same with prevention. It's really like, okay, I'm a family man now. I've got additional responsibilities. Let me think about growing up. And part of
Mhm.
the growing up is really, where am I at? Like, would I run my business and my company, you know, on a day by day basis? Like, oh, what do I feel like doing today? Or would I have at least planning for, maybe a quarter or annually? We spend really more time thinking about our physique and our, business and our finances than we do about our health. So it's time to start transitioning into thinking, how do I actually plan ahead and how do I make like a health uh, coaching and wellness decision that is going to be serving me well in 5 years, in a decade, in 20 years? How do I live better and longer, right? So the CRS, the cancer risk score, is helping to gauge that risk by looking at evidence-based risk factors of what are those things that are going to contribute towards cancer. So what type of diets, what type of lifestyle, what type of nutritional parameters are going to increase risk, what's going to decrease risk, what's and those things are going to have to do with insulin levels, with vitamin D, with cholesterol levels, with activity levels, with metabolic syndrome issues, with how much active metabolic visceral fat someone has in their abdominal cavity. So those parameters are going to drive risk. And in addition to that, obviously, there's a family history component, but only 15% of cancers are hereditary,
Really?
meaning about 85% of what happens to us is potentially very much reversible. Let me say that again. Only 15% is really stamped by genes. 85% is what happens to us and the choices we make as human beings. What do I do? And more importantly, even those 15% aren't really written in stone. Very few things really are. And the choices we make very much affect our genetic signatures. So if you have someone who's got a high risk signature genetically, but does everything perfectly, lifestyle wise and choices wise, then the risk may be actually lower for that person of developing cancers than for someone who is like, I can do whatever I want. I'm impervious. So we really have a lot of say, and that's why I decided to do this. Because I piloted this program as a head of oncology for my survivors, basically, in breast and colorectal cancer and prostate cancer, who kept coming to me and were cured, so it seemed, from their early cancers, but would be coming down with other cancers or diagnosed with early cardiovascular disease, all of a sudden would stop coming for follow-ups because, God forbid, they died from complications of metabolic syndromes, of diabetes, of strokes, and clots. And I'm like, there is a common denominator. And then looking at then sort of trends across the globe, we have so much data now from other countries, and including blue zones, as we call them, right? So where octogenarians plus live and in highest concentration, so 80s, 90s, 100s. What do they do in common in those zones that helps with health and wellness, longevity, mental health, connectivity? And it's really lifestyle, it's social connectedness, it's meaning, purpose, and daily healthy choices. So that's really, I think, helping the population awareness to say you really can make a huge difference in what happens to you.
I want to make sure I want to hear about when somebody like me would visit your office, become a patient of yours, what that experience really looks like. Hidden Nation, pmccdenver.com right now for all the information here on Dr. Mark Levandovsky. Also to take that CRS, the cancer risk score right now. I'm glad you mentioned other countries. Are we in fact one of, if not the most unhealthy country as a whole? And is that a problem?
Yeah, so for the amount of money that we spend on health and the outcomes we get, we are one of the unhealthiest countries. And 2/3 of Americans are frankly overweight. A third plus is frankly obese. And
that's the problem, right? That in essence is the problem.
I think that's more of a symptom of a problem.
Okay.
We will do as humans what's ultimately comfortable and give us this instant gratification, right? And there's been this provocative data that came out that looked at late night eating and showing that folks, especially men, actually, interestingly, middle-aged white men, to be more precise, if you eat late at night, you are more likely to die.
Period. Listen to that statement. If you eat late at night, you're more likely to die.
And the question was, well, is it because you eat something crappy that's going to cause, death? And that's part of it, but it's really a symptom. And the symptom is if you are eating late and it's a significant meal, there's much more likelihood that it's going to be comfort food and comfort meal. And then you're much more likely to do other things that are going to be damaging. So you're going to be dissociating more. You might be more likely to smoke, drink, do drugs, have poor relationships. And that's why you feel lonely and isolated. And by the way, 2 years ago, we had the first hit in longevity in middle-aged white men, as in mortality increased for the first time in decades. And that's from isolation, loneliness, and suicide.
What did that translate that to a more layman statement? What?
So that means that middle-aged men, white men, have been dying at a disproportionately higher rate, reported 2 years ago. Wow. And their average lifespan really dropped compared to the trends that have been going on for 2 decades plus, because we are becoming more isolated, more lonely, we're losing meaning, we're losing purpose, and we're leaning on all these instant gratifying things that are supposed to make us feel better, but actually make us feel bitter. So it was a Freudian slip, right? So it's really, I think that is at the root of so many of our issues as a country, as a society, and as an evolving world, right? We put so much emphasis on what makes you look good right now, what makes you feel immediately good right now. And so much of the foods, of the culture is really, do this, you'll feel better, you'll be more important, you'll be successful. It's what's the appearance, and that comes at a very big cost. The cost is social connection, intimacy, ability to really know where you're coming from and what's really driving you. So when we do those gratifying things, and the industry and the food industry and the marketing industry is very much plugged into it, so the commercials are really hitting our addiction pathways. And it's no surprise that things that, like, if you go to a bar, and then why do you have things that are carby and salty, is because your brain has like this amazing orgasmic experience with dopamine. It loves the plethora of different tastes, and it's super addictive. And then you're just going to start eating more and more and more, and satiety, so being full, saying I'm okay, I'm enough, is going away. So as a result, it's actually it's incredibly it's just very ironic. As a society, we go and basically indulge on these decadent foods that are really designed to make us addicts, really. And then we go and we buy things like Manjaro and other weight loss medications that from the big pharma, right? That uh, induce and inhibit those pathways, right? So basically, then we give ourselves a shot, so we turn off the desire, which we developed as a as a result of these comfort eating pathways. So I'm really focusing with the program as to saying, well, why do we do what we do? Like, what's driving us? How do we change that? So it's a psycho-emotional analysis in addition to, like, what are your parameters? So to answer your question earlier, what's the process of patient assessment? It really starts with, okay, what we look at over 150 biomarkers. Where are you at? Where are you at? What's your standard of care type of things, like what's your good and bad cholesterol, but what are your inflammatory markers? What are your sticky cholesterol markers? What are your tumor biomarkers? What are your stress levels? What are your hormonal levels? How subtly is it affecting your kidney function and liver function? Because again, 2/3 of Americans are going to be overweight. So we're going to have uh, liver inflammation, fat in the liver, and irritation in the liver, right? So we're going to have these plethora of markers that are going to say, Josh, you're 49, and internally, your biological age is much older than you. And we do that with biomarkers. I actually do carotid artery ultrasound that ages the arteries in the neck, as well as in the groin, as well as in the legs. So we can see, well, is your biological age the same as your physiological age? Like, so what you look like internally, is it the same as your birthday? Is it younger? Is it older? Because if it's older, then your risks of inflammatory and cardiovascular disease is going to be proportionate to what actually you look that actual biological age is. And if you're much younger, then great, And then how do you get younger? The upside of this, it's all very much reversible. And we know that for a fact. We have so much data from patients who were deemed too high risk with coronary artery disease to undergo bypass surgeries. And they were basically told, the only thing that we have available for you is these lifestyle modifications, plant-based diet, tree nuts, fish, things of that nature. sorry, we can't really help you. And then those cohorts were followed over decades, and they actually, with lifestyle and modification, they lived better and longer. Let me say again, they lived better and longer than the counterparts who underwent bypass surgery.
Wow.
So what we do and the choices we make, and the reason we make the choices we make, plays a huge impact on our health and wellness. And it's very much empowering, in my experience, for patients to hear it and to say, I can make an 85% reversal potentially in my health and wellness, my vascular age, my cancer age, and my cancer risk.
Wow. Sign me up, doctor. This is extraordinary, literally, right? Hidden Nation CRS, the cancer risk score right now, pmccdenver.com. Doctor, as we wrap up here, what do I need and how long is it going to take, right? I guess the CRS is exclusively online, or is there more to it?
It's about a 10-minute assessment. It's a freebie, so go online. No, no ask really. Educational. You'll also learn, as a potential, a person who is more proactively minded. What are the risk factors? Because we know that 2/3 of Americans at least don't know what the risk factors are. So it's really a combination of genetic information, of lifestyle, of food and diet and nutrition, as well as certain laboratory parameters. And the plethora of those parameters give you a score. And we kind of gauge it as low risk, intermediate risk, or high risk. And it's really designed to tailor individual risk assessment and then individual management, because it doesn't make sense to treat everyone the same, right? It's like you, Josh, Cary, you have a different risk of maladies and critical illness than I do, just because we're different people. And what traditional medicine does is it averages us, right? It's like taking a 7-foot tall fellow and a 5-foot tall fellow and saying, well, on average, they are 6.5. So I'm going to treat them, or 6.25, right? And I'm going to treat them both. So you're going to be over treating one and under treating the other. So there is no such thing as an average person. There is no such thing as an average risk. We're all unique. We're all crazy. We all have all idiosyncrasies. And the goal is really to come up with our own health portrait as much as we can. So that's really the cancer risk score is part of that. And really what's absolutely essential and cannot be underestimated is the fact that you really need to get to know the person. And my intake is about 3 hours. I sit down for 3 hours with the person to find out what makes them tick, what do they eat, how do they move, what's their 3-generational family history like, what's running in the family, what are the medical conditions, what are the biomarkers looking like. We measure their vascular age. We have a quantitative EEG, which measures their brain agility, neuroplasticity, brain age. So like how vigorous are you? What's your risks for health and wellness, dementia, Alzheimer's, and like PTSD even, right? What's your visceral fat? So it's really a plethora of factors that we look at from really head to toe, from brain agility to cardiovascular markers to an MRI of the abdomen as part of it, looking at critical organs and metabolically active fat, to saying, okay, this is your picture, and it's a result of factors X, Y, Z. How do we then build on that, and how do we make a game plan that's meaningful for you? So not like don't do drugs and do this, right? So this is your biggest risk. The risk is X% based on what we know. How do we chip away at it based on the evidence-based medicine that we have, based on global data, based on nutritional things, based on your gut health, based on your entire picture, and how do we reduce it? Because we can. We can.
Wow. Absolutely crazy. This is one of those topics where it's just never enough time. I can't wait to welcome you back, Dr. Hidden Nation. I said at the top of the show that this is an important discussion because of our health, and I think you understand why I said that. Dr. Mark Levandovsky, thank you a ton for coming on the program and sharing in all this with us today. Appreciate you.
My pleasure. Thank you so much, Josh. Be well.
And there you go, Hidden Nation. You also be well. Perhaps take some action right about now. pmccdenver.com for all the information on Dr. Mark here, including that cancer risk score. So important, isn't it? Well, thank you for tuning in and spending and investing your time with us today. We'll do it again before too long. Until we do, take care. Be well.